Well, for more, we're joined by Tarik Jasarevic, who joins us from the World Health Organization in Geneva. Tarik, thanks so much for speaking to us. How much do you actually fear that this instability now and attacks on these centers could actually hinder the work you're doing to prevent Ebola's spread?
Well, we know that every time there is an insecurity, there are security incidents, our work is disrupted or slowed down. We had such an instances in September, in November, and for example, yesterday, our team was not able to operate in Beni. And every time we are not able to go to community and provide those Ebola response activities, such as vaccination, surveillance, getting people who are possibly infected to get tested, those who are infected to get treatment. So all that will mean eventually that there will be more cases and that Ebola outbreak will continue. So we know that that security is an important element in this fight against Ebola this time, and this is why we are still fighting the virus after 5 months.
Right. Do you think, though, there is a failure to understand the gravity of Ebola in the DRC, and why is there that lack of understanding?
Well, I think there was a big change in understanding of Ebola in North Kivu, because we have to understand that although this is 10th outbreak of Ebola in Democratic Republic of Congo, it is the first time that it's happening in this area. So by now, population knows what Ebola means because they may have seen it around them. So the civil society and population in general is accepting the response. So what happened yesterday, for example, there was demonstrations in Beni and there was attacks on government buildings, and sort of attack on this Ebola transit center was a collateral damage. Civil society did issue a call to let Ebola responders continue their work, because people do understand that it does affect everyone.
Okay, well, that's at least good to hear. But let me ask you this. President Joseph Kabila said it would be a, quote, disaster to go through with the election in those outbreak zones, because he said a single person could infect hundreds of others. Is he correct in saying that, or do you think he's using the outbreak to play politics, as his critics are saying?
Well, this decision has been made by the government of DR Congo based on their assessment. What we know is that Ebola response activities do work if we are allowed to go everywhere we need to go and where we go. We work very closely with the Ministry of Health to support them together with other partners. We have more than 300 people on the ground as the World Health Organization. Ministry of Health has 800 people on the ground. But we have really all these elements that really make the response more difficult. That's the insecurity. We have a now virus in bigger cities like Butembo that has more than 1 million people. We have a mobile population. We have a proximity of borders. So all this makes it complicated. But we are confident that if we manage to get a level of security that will allow us to go and do our job, that we will be able to end the outbreak.
Okay. Tarik Jasarevic, we will have to leave it there. Thank you so much for joining us from Geneva.